Are you dealing with itching and pain from skin conditions like scrapes, minor irritations, or insect bites? Or are you experiencing nerve pain after shingles? If so, a lidocaine adhesive patch might be able to help. This patch contains a medication called lidocaine, which is a type of local anesthetic. When you apply the patch to the affected area, the lidocaine works to temporarily numb the skin, providing relief from discomfort. Just apply the patch to the affected area as directed by your healthcare provider, and enjoy the soothing effects of lidocaine. Remember to follow the recommended dosage and timing to get the best results. When using this medication, be sure to carefully follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Only apply this patch to normal, unbroken skin. The dosage will depend on your medical condition and how you respond to the treatment. Remove the protective liner and place the patch on the area of your skin that is most painful. Use the number of patches prescribed by your doctor, usually once a day. Depending on the product, the patch can be left on the skin for up to 8 or 12 hours. Follow the instructions carefully and do not apply more than 3 patches a day or leave a patch on for longer than instructed. If you need a smaller patch, you can cut it with scissors before removing the liner. It's best to avoid getting the patch wet, but some brands can tolerate brief exposure to water, like a 10-minute shower. If the patch does get wet, gently pat it dry. After applying the patch, be sure to wash your hands well. Avoid getting the medication in your eyes or on mucous membranes. If it does get in your eyes, rinse them with water immediately and protect them until the feeling returns to normal. If your condition doesn't improve, gets worse, or you think you may have a serious medical problem, seek medical help right away. Used patches still contain some medication, so do not reuse them. Fold the used patch with the sticky sides together and throw it away out of reach of children and pets to prevent accidental swallowing or application. If you experience redness, swelling, blisters, or changes in skin color at the application site, these effects typically go away within a few minutes or hours. If they persist or worsen, notify your doctor or pharmacist. If you feel irritation or a burning sensation, remove the patches and do not reapply until the irritation has subsided. If your doctor has prescribed this medication, it's because they believe the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. Notify your doctor immediately if you experience any serious side effects, such as blurred vision, changes in mental state, like nervousness or confusion, drowsiness, dizziness, or an unusually slow heartbeat. Seek medical help right away if you experience very serious side effects, including pale/bluish/gray skin, unusual tiredness, shortness of breath, or a fast heartbeat. While a severe allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects not listed here, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before using lidocaine, make sure to inform your doctor or pharmacist about any allergies you may have, especially to local anesthetics. Also, let them know about your medical history, especially if you have liver disease or a certain blood disorder. While wearing the patch, it's important to avoid exposing it to direct heat sources such as heating pads, electric blankets, saunas, or prolonged direct sunlight. Heat can cause more of the drug to be released into your body, which can increase the chance of experiencing side effects. If you are going to have an MRI test, it's crucial to inform the testing personnel that you are using this patch. Some patches may contain metals that can cause serious burns during an MRI, so you may need to remove the patch before the test and apply a new one afterward. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before using this medication as it can pass into breast milk. It's important to be aware of potential drug interactions when using lidocaine adhesive patch. This medication may affect how other medications work and could increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If the patch is chewed or swallowed, it can be harmful. If someone has taken too much of this medication, remove the patch if possible. In serious cases like passing out or having trouble breathing, call 911. Otherwise, contact a poison control center immediately. Symptoms of overdose may include severe drowsiness, seizures, slowed breathing, or a slow/fast/irregular heartbeat. If you are in the U.S., you can call your local poison control center at 1-800-222-1222. If you are in Canada, you can call a provincial poison control center. It is important to seek medical help if you suspect an overdose. Remember to keep this medication out of reach of children and pets. Now, let's talk about the Lidocaine Adhesive Patch, a medicated topical local anesthetic. This patch is used to relieve nerve pain caused by shingles or other painful skin conditions. It works by blocking the signals in the nerves under the skin. The patch should only be applied to the skin by a healthcare professional. It is usually applied for 12 hours on, followed by 12 hours off or as directed by your doctor. Make sure to follow the dosing schedule provided by your doctor. Do not apply more than 3 patches at a time or use patches for longer than prescribed. It is important to keep all regular medical and lab appointments for proper monitoring. If you are using the lidocaine adhesive patch on a regular schedule and happen to miss a dose, simply use it as soon as you remember. However, if it is close to the time of your next scheduled dose, it's best to just skip the missed dose and continue with your regular dosing schedule. It is important not to double the dose to make up for the missed one. Just use your next dose at the regular time as prescribed. Remember to store the lidocaine adhesive patch at room temperature and keep it sealed in its protective envelope until you're ready to use it. Also, make sure to keep all medications out of reach of children and pets. When it's time to dispose of the patch, follow the instructions in the How to Use section. And don't forget to properly discard the product when it's expired or you no longer need it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.